Hello, this is Dr. David Green, CEO of the Washington Pain Network. Today's topic is what are the best treatments for spinal stenosis? Spinal stenosis is a narrowing of the spinal canal with subsequent pinching of nerve roots as they try and get out from the spinal cord. It's usually due to bony and soft tissue overgrowth from arthritis, and it typically occurs in patients who are over the age of 50, and it's often seen at multiple levels. Here you can see on the left a normal spinal canal, plenty of room for the spinal cord, lots of space around it. Here you see one that has arthritis coming out from these facet joints here with bony overgrowth. There's also soft tissue overgrowth, but basically you can see what's happening is this is turning into a triangle as opposed to a nice ellipse. The symptoms of spinal stenosis may include typically an aching pain in a person's buttock and legs on the affected side, may have symptoms of sciatica. In unusual cases, a person may get leg weakness, and it may be mistaken for a hip joint problem, depending on which nerve roots are being affected. With spinal stenosis, the symptoms are often position-related. Patients will say that if they feel better when they lean forward, and that would mean like walking upstairs, a person leans forward, or walking in the supermarket where they lean forward on a shopping cart. That helps open up the spinal canal and frees up nerve roots. There needs to be a distinction between neurogenic claudication, which is from spinal stenosis, versus vascular claudication, which is from peripheral vascular disease. So let's say a person starts walking and they start having pain in their lower extremities. If they say that it starts in the calves and it sort of moves up the leg, that's typically from vascular claudication. If it's neurogenic claudication, usually they'll say it starts in their buttocks and moves down into the thighs. That's usually neurogenic. Most people with spinal stenosis actually have no symptoms. A lot of times it's just an incidental finding on MRI, but a person is pain-free. Treatment options for those who do have symptomatic spinal stenosis would consist of over-the-counter nonsteroidal anti-inflammatories and Tylenol. For acute exacerbations, narcotics may be beneficial. Neurontin and Lyrica are neurogenic medications. We don't know how they work, but they do work nicely for spinal stenosis. Physical therapy, spinal decompression therapy can be helpful. Epidural steroid injections are the gold standard treatments. You can see here on the right a caudal epidural. So this is the lumbar spine, the sacrum. This is called the sacral hiatus. A pain doctor will inject a large amount of steroid medication and numbing through the sacral hiatus. The liquid migrates up, and it can actually help bathe inflamed nerve roots at multiple levels and give excellent pain relief for anywhere from days to weeks to months. Whether or not to have surgery for spinal stenosis is truly a quality of life decision. It's not a life-threatening problem. Okay, it's like arthritis. Nobody ever died from arthritis. So the decision should only be made after considerable conservative treatments fail, typically from the above list. The surgery that is performed is called a lumbar laminectomy. That takes a little bit of bone off of where the nerve roots are being pinched and help freeze them up. If there's instability or some other issues, then a fusion may be added to the mix. The procedure includes a lumbar laminectomy where you take the bone off either the right or left, or if both sides are being pinched, you could take it off in the middle. So you see how it's freed up these nerve roots. Okay, it's about a 1-hour procedure. Typically a fusion is not necessary, but if it is, that will add some time and blood loss and risks. It's a low-risk surgery just for a laminectomy. Half end up with stiffness post-operatively as a result of the surgery. There is a chance of post-laminectomy syndrome. Basically what that means is you free these nerve roots up, eventually they can develop scar tissue around them and you can get the pain back, and that pain may never go away actually. The chance of that happening is less than 1%, but it does happen. The bottom line is that surgery can be avoided over 90% of the time. Epidural injections can be repeated every few months. Whether or not to have surgery is truly a quality of life decision. And then if you have to add a spinal fusion to it, it does add a whole level of complexity to the procedure. The top non-operative pain management is through the Washington Pain Network. We have multiple clinics throughout the state, including over 25 treatment options, accepting over 50 insurance plans. The average success rates are over 90% with the board-certified award-winning doctors. Visit us online at washingtonpainnetwork.com and then call us at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.